Hi, I'm here with Congressman Frank Pallone at Families USA in Washington. This is the day after the State of the Union. Congressman Pallone, do you think we're going to get a public option again via a reconciliation now that we know the fallacy of a 60-vote supermajority?
I think it's still going to be difficult to have a public option because, again, you still need a majority in both the House and the Senate. And, before the Massachusetts election, basically the compromise that had been worked out between the House and Senate didn't have the public option. So I think to change that now would be difficult,
so
as much as I'd like to see it.
Do you think we'll see a Medicare buy-in?
No, I don't think so.
Does leadership understand that without a public option and without Medicare buy-in, base Democrats, just like myself, are going to sit home in 2010?
Well, I hope that's not true.
All the latest polling shows that. We did a Research 2000 poll of 10 freshman districts. Democratic voters want their representatives to do more, not less.
I don't doubt that what you're saying is true, but I just think that realistically it's going to be very difficult to get the public option. And I would hope that people would understand that if we do, have comprehensive health care reform that has the health exchange and at least has competition, between private plans and has a major subsidy to help people pay their premiums, certainly costs won't come down as much as they would have with a public option, but I still think it would be a lot more affordable and provide more people with coverage than we have now.
Will this be a state-based exchange or a national exchange?
I think we're pretty much agreed on a national exchange.
And do you think, so what would you predict would be what will this legislation look like if it happens?
It'll be, in some ways, more like the House in the sense that there would be a national exchange. There would be major subsidies for people up to, families that are making up to $80,000 per year, to make it cheaper for them to buy insurance. We would eliminate all discrimination based on pre-existing conditions or gender, and also it would change the way we actually provide health care in a significant way because there would be more emphasis on prevention. People would be able to see a doctor on a regular basis rather than going to an emergency room or a nursing home. The emphasis would be on prevention.
Are you getting the leadership from the White House that you think you need in order to get this legislation passed?
I believe the president has been very active in trying to bring the House and the Senate together. If it wasn't for the Massachusetts election, I think a bill would already be signed into law.
Did you say he has or has not?
I think that until the damper that was sort of put on things from the Massachusetts Senate race, the president had been effective and that we were ready to have a bill that, blended the House and the Senate versions. The problem for the president and all of us now is that people are reticent because of the Massachusetts election to vote for a bill, and we've got to get over that. He made that point in the State of the Union address, be bold, take action, don't sit on your hands. So if he keeps that message up, I think we'll get the votes that are necessary.
So you're basically echoing what the American people think, which is their elected representatives are more worried about their seat in Congress than about the most critical and dire health care needs of their constituents.
Well, you put it in a different way than I would.
Well,
I would say that everyone who's in office, wants to do what's best for their country and their constituents. But because of the volatile political situation, a lot of them are not sure now what is best. I know what I want, which is I want a health care reform bill pretty much along the lines of what passed the House. But again, we have to get the votes, and there is a certain amount of reticence now in light of what happened in Massachusetts.
Okay, so we will see in November. I think it's going to be a very bleak November 2nd for Democrats. If the narrative that you're describing is accurate, because I don't
agree. I think that I think that people will realize that it's difficult to get things passed, but if we actually get a health care bill passed, if we get a climate bill passed, if we pass some initiatives to make a difference for the economy so that we bring down unemployment, then I think that the climate, will become good for Democrats. We have to accomplish those goals.
One final question, Representative Pallone. If the president fails to sign a health care bill into law, what will happen to Democrats in November?
Well, I don't want to think of that possibility because I think the will is there to pass the bill and it will be signed.
Okay. From your mouth to God's ear. We'll see. Thank you.
Thank you.